All right, we should be good to go. All right, so we're going to take a little bit of a look at essentially the appendicular skeleton today. So these are our upper extremities and lower extremities. There is going to be a lot of stuff on the slides. I'm going to try to kind of condense that as best I can for you because there's not as much of it that you really will need this time around for the assessment. But I just want to try to give you as much information as we can. Okay. So we're going to start just kind of identifying the basics of the appendicular skeleton. So it's broken into kind of three sections. We get the limbs, the upper and lower. All right, we essentially refer to those as appendages. You have the pectoral girdle, so that's the clavicle and shoulder blade or scapula. And then you've got the pelvic girdle, which essentially is just those innominate bones on both sides. We a lot of times refer to those collectively as coxal bones. Okay. Well, we'll go through a little bit of these and kind of talk about them. All right, is everybody okay? All right, so we'll start here at the upper extremity and kind of work our way down. So we'll start with the pectoral girdle, or what's often referred to as the shoulder girdle. It's composed of two bones. You've got the clavicle, which is the collarbone that goes all the way across the front. It actually attaches here at the sternum and then goes out and actually attaches to the outer portion then of the what's referred to as the scapula, all right, which is also our shoulder blade. All right, those two bones, because of the way they kind of attach to our skeleton, is what gives our upper extremity the range of motion that it has. None of our and no other joint in our body has the range of motion. Bless you, of the shoulder. All right, you can essentially turn your shoulder 180 degrees, 360 degrees, and rotate it. Whereas you can't really do that with your hip because of its design. All right, but the shoulder, we've got some pretty free movement in it. Which is also sometimes why we see so many problems with the shoulder as well, because there is such free movement. It can lead itself to some issues. All right, so here's the bones of the shoulder girdle that we can kind of take a little bit of a look at. So you've got the clavicle over here on the right, and then you can see the entire one over here on the left. This is kind of the joint that essentially we're talking about. So the pelvic girdle, or sorry, shoulder girdle, has got two joints. There's a joint here that's called the acromia, or sorry, the clavicle sternoclavicular joint. All right, so that's a joint between the clavicle and the top of the sternum, that manubrium. All right, there's another one out here that's referred to as the AC joint or acromioclavicular joint. All right, so that's between the clavicle and the kind of portion of the acromion of your scapula. All right, and then the scapula kind of has a joint, but it really is not much of a joint back here with the ribs. All right, so all of this back here, the scapula itself is actually only held onto our skeleton by muscle tissue, which is one of the reasons why we sometimes have so many issues, especially in sports, with people with their shoulders. If you don't have really good control of that scapula through muscle control, you can have a lot of issues because you can also see there's not a lot of space right there in that scapula between it and the humerus. Okay. This just shows you a little bit of the kind of scapula itself. Right, it's kind of an irregular shaped bone that we have. There's a couple of processes on it that we normally would take a look at, but we don't really need them for this time. So you've got the acromion, which makes up the tip of your shoulder blades. That's the bony prominence you can kind of see or palpate on most people. You've got another one called the coracoid process, which is actually down inside of the shoulder right here. That's where part of your pec muscle attaches to, and then there's a bicep tendon that comes up and attaches in there. Okay. For the upper limbs, then we got a couple bones. So the top bone in the upper arm is called the humerus. All right, we got two of them, one by on each side. All right, it's designed similar to the femur, so it's got a head portion, kind of a lower portion down here, This little prominence out here is called the deltoid tuberosity. That's where your deltoid actually attaches to it. People that have fairly well-defined shoulder muscles usually have like almost like a V shape in their deltoid, and that V shape comes down, and that's where that deltoid tuberosity is. These prominences up here, again, you don't really need them for the assessment, but I just wanted to kind of show you them. So there's a greater and lesser tubercle, and then this little path right through the middle here is where your bicep tendon kind of goes through. All right. So if you've ever rotated your shoulder around and hear or feel kind of a snapping sensation, there's probably a good chance that your bicep tendon is moving in and out of that groove. All right. I played baseball all the way up through college. So if I grab something with any kind of weight to it and try to set it behind me, like when I pass something to the back seat to one of my kids, I'll feel that. I'll feel like a popping sensation. There's supposed to be a tendon that's supposed to hold that down. But a lot of times in athletes, that tendon gets torn pretty easily, and then that's the result of it. Okay. Um, Other bones of the upper arm, then. So we have the radius and ulna. Okay. So ulna is pinky side or little finger. Radius is thumb side. Okay. So when you're looking at them on a skeleton, if you have to identify them, if you can find where the thumb is, the radius will always be on that side, and the ulna will always be on the pinky side. Okay. You can see there's some little bit of design to each one of them. The ulna is the one that actually articulates directly with the humerus. The radius actually sits here kind of in front. When you palpate them, so if you take and put your finger on the tip of your elbow, right, and rotate your hand, that's your ulna. The ulna doesn't rotate. All right. So this movement of moving your hand into pronation and supination is actually done by the radius. So when you turn your hand down, the radius is actually rotated over in an X shape across the ulna. Okay. I can kind of show you that on the skeleton. So here's palm up. Yeah, everybody does it, and that's fine. So here's palm up. You can see both bones are in line. If I turn the skeleton so his palm is down, you can now see the radius rolls right over the top of the ulna. Okay. So that's why a lot of times if you were to fall in this position, it's a more anatomical position and you wouldn't hurt yourself. But most people don't fall this way, right? We fall with our hand turned over this way. And because of that, it puts a lot more pressure on either the radius or ulna because of that design there. Okay. Bones of the lower limb then that we have. So the upper bone is obviously the femur, right? That's our thigh bone. Right. Similar design to the humerus. We've got head portion. The femur's got a little bit more of an extension called the neck. All right. And then obviously there's the shaft of the femur that we see. And then this is the portion that would articulate with the lower leg. Fractures that most often happen are neck fractures. So they break somewhere up in here because of the way that it attaches to the pelvis. All right. Because that's where it would take the most force if you were to take a blow. Older individuals a lot of times will break this portion off. It's called the acetabulum, the top portion of the femur. All right, this round portion up here at the top. And interestingly enough, young kids a lot of times will have issues with that acetabulum because there's a growth plate right there. Okay, so there's a growth plate that kind of goes through this section, and they can get what's called a skiffy. We call it a slipped femoral epiphysis. So that acetabulum actually slides off the head of the femur. All right. A lot of times when we've got an athlete, young athlete, high school age, and comes in and they complain of groin pain, but they have no groin injury, so the muscles aren't hurt. They might actually have some sort of an issue there. We've actually had two here in the 10 years I've been here at South, right, and identified both of them. So it is common. We do see it every once in a while. Lower leg bones. All right. So you've got the tib and fib. All right. So we got the tibia and fibula. So the way that I kind of keep these straight in my head is the tibia is shorter, right? But it's the bigger bone. So I always remember the short name goes with the bigger bone, the longer name goes with the little bone. So the tibia is here kind of more medial, all right? So if we think medial and lateral on the lower leg, the tibia is more medial. The tibia is also the weight-bearing bone of the lower leg, all right? The fibula really does not. The fibula really is there just kind of as an attachment for muscles. Okay, it's not part of the knee joint. which is why if you have somebody break their fibula, they could probably still walk. It might be painful, all right, because there are muscles that attach to it, but they could probably still function and walk and not have any issue. Okay. I've had a few of those, especially football players. A lot of times will get landed on in a certain position and they'll break their fibula, and then they'll get up and come off to the sidelines and be like, "Well, it just doesn't feel right." And you get to palpating around and you get to one spot on their fibula, and that's really painful. Sure enough, they go get an X-ray and it's fractured. And they're like, "Why?" And the kid always comes back and they're like, "I wouldn't have thought it was broken because I could walk." Well, it doesn't bear weight for us. All right. So if we do break it, we can have that. The other thing we see a lot of times in the lower leg for injuries, if you notice, the fibula sticks down just a little bit lower than the tibia. Because of that, it actually articulates specifically with the foot. So any ankle injury can cause a fracture in this fibula. All right. So a lot of times, if I have a kid that says they sprained their ankle, one of the first things I check is this joint up here. I palpate what we call the head of the fibula to see if they've broken it. All right, because a lot of times they'll wedge that fibula out. All right, and if we get it wedged far enough, it'll just snap. Okay, so we want to make sure we check to make sure. Otherwise, a lot of times they have a lot of injuries down here towards the bottom. Okay. Bones of the hand. All right, so there's a lot of bones in here. I'm going to highlight the ones you specifically need. All right, so the bones of the hand come in three sections. You get what are called the carpals, metacarpals, and then the phalanges. The carpals are these bones right through here. Okay, those are the ones that make up the wrist. There are 8 of them, and normally we would have you guys memorize them, but you don't have to for this go around. This is a really good mnemonic to kind of remember how to do those, though. So it's called so long to pinky. Here comes the thumb. So you start proximal here at the thumb. This is the scaphoid right here, and then you just kind of work your way around. This is the bone that I was talking about, I think, the other day, that if you fracture this scaphoid bone, all right, a lot of times it doesn't want to heal. So if you extend your hand out like this, you're going to notice that there's a set of tendons that make a little pocket right there at the end of your thumb. They call that your anatomical snuff box. All right, if a kid falls like this and they start to complain of wrist pain, that's one of the first places I'll palpate, is in that little anatomical snuff box, because that's where the scaphoid is. If they've got a lot of pain in there, you're going to go get an X-ray really quick because it doesn't want to heal. The longer we let it sit, it will kind of break down. Metacarpals then are next. So those are the ones that make up the palm of the hand, so kind of the back and the palm of your hand. There are 5 of them. And then the phalanges, all right, are the distal section here. All right, each finger has 3, so there's a proximal, middle, and distal, except your thumb. Your thumb just has a proximal and distal. It doesn't have the middle phalange. Okay, everybody good? Okay, there you go. All right, from there, we're going to move to the foot. Same thing. You don't have to know all these little bones in the ankle. Just know them collectively. All right, so the foot has got 3 sections just like the hand. So the foot has what are called tarsal bones. That would be everything from the metatarsals backwards. All right. The heel bone itself is known as the calcaneus. And then the other bone that I think's not really important for the assessment, but I think is kind of nice to know, is this thing called the talus. That's the portion that actually fits into the bottom of the tibia. So your talus actually fits up into here, all right, and articulates with the bottom part of your foot. Lots of other little bones that kind of associated with that. Sometimes if we're looking at people, whether they have flat feet or not, this navicular is another bone we'll kind of take a look at, because it actually helps support the arch of your foot. Okay. From there, you've got metatarsals. All right, those are the section out here through the foot. Again, there's 5 of them, 1 for each toe. All right, and then the last ones are your phalanges. All right, that's this section out here. Again, there's a proximal, middle, and distal, except the big toe. There's just a proximal and distal on the big toe. Okay. Other things that sometimes will happen here in the foot, a lot of times this little portion right here is called the base of the fifth. All right, that's an easy place to fracture a lot of times because it kind of sticks out to the side. When we're taping ankles, we kind of have to keep an eye on that little base of the fifth. You don't want to put tape over the top of it because if you compress it, it's painful. All right, so you want to kind of keep an eye on that. If I go back, I missed one in the hand. This bone out here is most often fractured when people punch things. Right? We call it a boxer's fracture. So if they take their hand and punch the wall and there's a stud behind the wall, they always find it. My wife used to be an ER nurse, and she always would say that that bone is the stud finder, right? Because people get mad, punch the wall, and then they break that bone. Right? We call that a boxer's fracture because that's the bone that normally takes most of the force for it. Okay. Let's see. Bones in the foot. So there's two arches. There's a longitudinal and a transverse arch. So longitudinal is essentially all the way across the foot like this. And then transverse is the one that goes side to side this way. All right. Those should have, everybody should have a little bit of a cup to their foot, but we notice over time people tend to lose that arch. It is also genetic. So if most of your family members have really flat feet, you probably are going to have them as well. All right. All right. Last little bit here, then we'll talk a little bit about the pelvic girdle. All right. So these are essentially our hip bones. There's three kind of pairs of what are referred to as fused bones. So there's the ilium, the ischium, and then the pubic bone. Okay. I grab one of them here. So we'll take a look at them here in just a second in the PowerPoint. But the ilium is this section up here at the top that kind of makes this broad wing. The ischium are the bones that you actually are sitting on currently. All right, that's the portion. And then the pelvic bone is this section that joins here in the front. Right, everybody swishes around a little bit. Okay. Big things here for the hip bones is they protect several organs. So most of our reproductive organs are housed here, right, for protection. Urinary bladder is also here, and then the lower part of our large intestine is also housed in those bones. All right, which is also one of the reasons why if we have a hip fracture, it can become really serious, right? Because the bone itself can lacerate any one of those organs then after that. That's really uncommon in high school kids. I've never seen a pelvic fracture. Usually I've seen dislocations, which are also still really uncommon. All right. But was it? Yeah, it was last football season. We had a JV kid from another school dislocate their hip. And you could see it on the video. Like he had almost the entire weight of three other players go on his leg. And his leg was back behind him and he got folded over his leg. All right. Yeah. In sports, to be honest with you, I've never really seen one get broken. Most often those happen when people fall down the stairs. Yep, or like when it's slick and icy out, a lot of times it'll get broken. It's really hard to break because it is pretty well protected. All right, our glute muscles do a pretty good job of that. But sometimes it does happen, and there really isn't anything you can do for it besides just give it time to heal. No, and I suppose you could. Yeah, you get one of those little donut pillows. I suppose you could go in and put a plate in it, but that would be a really sensitive area to cut open and then put a plate next to you. So, okay, everybody good? Okay. All right. So pelvis itself, just kind of take a look at it here. This is the sections I already kind of shown to the kids in class. So you've got the iliac crest here at the top. This is that broad kind of bone that you see kind of stick out on a lot of people. There's a couple joints here. Again, you don't need them for the assessment. I just want to show you. So there's one on either side called the sacroiliac joint. All right. This is what's referred to as the pubic symphysis. So it's a piece of cartilage that actually fits between the pelvic bones in the front. A lot of times, older individuals who still run for exercise will have issues with that joint. Right. It's very painful because every time they run, those bones are moving. Right. And it's kind of grinding on that. This going across here is called the pelvic arch or the pubic arch. All right. And this is the other half of it. You got your ischium down here at the bottom. Like I said, those are the bones you're currently sitting on. And collectively, we simply just call those coxal bones. All right, because they're all fused. We can't really tell the difference between them. So we essentially just call those coxal bones. All right.
Charlie, that one episode where Bob falls down the stairs and he is in the hospital, and Amy's like, "What are you doing here?" And he goes, "I broke my coccyx."
Well, that would be his tailbone. So yeah. Okay. Just a couple other things you can see here. This diagram highlights the differences between the sections. All right, a little bit better. We talked about this one the other day, the little bit of the gender differences. I think I kind of identified them for you, but you can see them really here. All right, so the top section, this is male. All right, the bottom section, this is female. All right, so you can see the distance between the wings of the pubic, or sorry, the ilium, all right, are lesser. They're greater in the female. This opening here, so the distance between the arches, all right, is much greater in females than males. All right, the other thing we see is the pubic arch itself. If it's less than 90 degrees, it's almost a V shape. All right, so it almost goes straight up and straight down. That's male. If it has more of the kind of this U shape to it, that's going to be female. Again, you have to remember this section through here is where the baby's head's going to pass through. All right, to be able to get into the birth canal.
That's why the hips are wider.
That's why the hips are much wider. Also, usually towards the end of pregnancy, there's a hormone release called relaxin that causes all of these ligaments to relax. So the ligaments here on the joints between the sacroiliac, all right, and then the pubic symphysis joint also softens, all right, which is not unheard of for women usually at the end of pregnancy to have issues with low back pain. All right, my wife, when she was pregnant with our son, which would have been our second kid, she had a lot of issues because her pelvic bones essentially just wanted to move all the time. All right, because those ligaments were so soft. It's not also unheard of. I've heard of women who the ligaments become so soft that they actually dislocate their hips sometimes walking. All right, because they can be sitting in a position, go to get up, and then that pelvic bone, that bone kind of rocks itself out of there. Okay. All right, I'm gonna go ahead and stop there. I'll shut that video off for those guys.